Hello, my name is Erica Lafferty. I'm from the Oglala Lakota College, and today we'll be presenting the COVID-19 infrastructure project. Our overview will be the introduction, our data reckoning, vulnerability, resources, the MHA tribal dashboard, and our group's next steps. As you can see, just from headlines below, that COVID-19 does have a significant impact on tribal reservations and Native American communities throughout the country, and they do have a hard time kind of combating this pandemic. Next slide. Some of the OST, which is the Oglala Sioux Tribes health statistics, according to the Red Cross, some statistics that were out there for the Pine Ridge Reservation is their infant mortality, which is the worst on this continent, and the reservation's death rates are astonishingly higher, from cancer being at 500%, alcoholism at 500%, diabetes at 800% than the national average. A third of the houses on the reservation don't have electricity or running water, while the reservation says 60% of the homes have traces of fatal black mold that can be devastating during this pandemic. The COVID-19 pandemic also brought many scars and issues to the reservation. The county has just recently uplifted their lockdown protocol in late July. Next. As you can see, the two boundaries that we chose to focus on in this first phase of our project are, at the left, the Fort Berthold 3 affiliated reservation, which is located in North Dakota, and the Oglala Sioux Tribes Reservation, which is located in South Dakota. The project focuses on two very distinct Native American reservations in the United States, and how the data collection, coding, and ArcGIS will be used to be able to assist these tribes in identifying key areas for high risks of COVID-19 and other pandemics that may come in the future. During this project, we broke down into multiple phases. The first phase will be focused on the two reservations, the 3 affiliated tribes and Oglala Sioux Tribe. Individually, these reservations present very unique circumstances. The 3 affiliated reservation is a major oil producer, and thus is not economically feasible for them to shut down or create border patrol. The OST reservation is able to do lockdowns and enforce curfews, but lacks the funding and resources to combat this pandemic. By utilizing their data sovereignty, coding, and ArcGIS, the Oglala Sioux Tribe will be able to secure more funding to adequately combat this pandemic. Next slide. Some of the methods our team took for data resources was utilizing the Center of Disease Control, the Oglala Sioux Tribe Health Administration Facebook page, the American Community Survey, 3 affiliate tribes, MHA COVID-19 dashboard, Oglala Sioux Tribes Facebook page, and the Oglala Sioux Tribe COVID Task Force Emergency Management Team. Each aspect presented today are key factors in progressing this project. Next slide. And Kiva will go over the next steps.
Hello, my name is Kiva Goodcrow. I'm from the Oglala Sioux Tribe. As of right now, our tribe does not display the COVID-19 data as a dashboard. They create it as a PDF file. So what I implemented was that I have to compile the PDF files and create a spreadsheet and convert it into a CDC file and be leading to a dashboard. And our phase 2 will be creating a dashboard and disseminating the data. Next slide. So importing our CDC file into Jupyter Hub, this is what the code that we had to start off with. Next slide. Once we got the code and graphs created, we had established that there are missing values and missing data. So in the 99, the reason why the graph looks like that is to show that there is data missing on a reservation. That's the reason why we ran into the issue that why the tribe in the state didn't have the same numbers. So that's what I did to represent our COVID-19 data on the Pine Ridge Indian Reservation. Next slide. And this is Alicia.
Hami Dakyapi, Alicia Yellow Thunder Machiapi, Wazi Ahaha Oyanke Hemataha. Hello relatives, my name is Alicia Yellow Thunder and I am from the Pine Ridge Indian Reservation. I wanted to, the aspect of for me was mapping our elders. Our elders represent traditional libraries for us and they're extremely revered. They're churches, libraries, educational centers, therapists, and all of those different aspects. So being that research is showing that elders are one of the most vulnerable populations for COVID, we thought that it would be a really good idea to give visualization to where our elders are and what their population is. Next slide. The reason why we needed to do this is because pretty soon there's going to be another, a second wave of COVID funding for the tribe, and the tribe has totally exhausted all of the previous funding. And so we want to help them to better mitigate where these disaster funds should be properly displaced. And part of that is making sure that our elderly community is taken care of, and that our elders who oftentimes have heart disease and diabetes are being acknowledged and given the resources they need. Next slide. The how was, I just ran the basic codes that we learned. I'm super novice, so I just did some matplotlib and some pandas. And then we are working on, it's so hard because we have to start from scratch, you guys. We neglected to say that. We have to consolidate all of this data on our own. None of this data exists, so we had to do it. So we're still doing that. Next slide. And so this will be my end goal. I want to do percentage. Oh no, I'm over my time limit. I want to do percentage. Sorry guys, I'm going to do percentage of elders so that we can disperse these fundings, because this is where our resources need to go. And then Erica will speak about our resources.
Some of the resources that the tribe does already have in place is they have 3 Indian Health Service facilities, which are the hospitals on the reservation. So 3 of the health facilities on the reservation are there to serve, but only one of them is equipped to test and treat for COVID-19, which is located in the Pine Ridge Village District. The Pine Ridge Reservation has a population just over 22,000 residents who currently reside on the reservation. They do have access to 2 off-reservation Indian Health Service facilities, one which is in Pennington County, which is the higher H, the H logo up on your map on the left side. That is all the way in Rapid City. That is the Monument Health facility, our hospital here in Rapid City. The other off-reservation one would be in Martin, which is down here in your green section. However, Martin is only able to test but not treat COVID-19. So majority of the residents will have to travel off reservation into Rapid City to be treated. Another resource that the tribe has started up with the funding is OST COVID-19 Task Force Emergency Management offers assistance. They offer food, cleaning supplies, medical help, and quarantine sites. With coding and mapping and that we can utilize from this program, it will greatly benefit the tribe in helping target future outbreak sites on the reservation, as well as future projects down the road for where to send funding and how to assist for help. Next slide. Another big target that we wanted to focus on was the schools on the reservation. For the Oglala Sioux tribe, they have a total of 17 K-12 schools and 2 early preschools. They have a student population of just over 5,000, which was their last fall's 2019 numbers. Throughout all those schools, they only have 1 full-time nurse and 2 part-time nurses. The tribe is, however, able to request more funding and delegate their funding to where schools will need more help with support staff. If we are able to use this coding and funding, we can help them delegate where to send their funding and assist in identifying needs, schools that are needed to hire more nurses for each of the school districts. Next slide.
Hello, I'm Kimberly Blevins. I'm an enrolled member of the Mandan Hidatsa Arikara Nation. Many tribes have taken different routes with their data. The MHA Nation has utilized the data dashboard, hence what you're looking at now. Slide. Data was collected from the dashboard to calculate positive rate. The positive rate can then lead us to things like community spread. Slide. Data was gathered from the dashboard. We gathered things from positive cases. Each date reflects positive cases on the Fort Berthold Indian Reservation. Slide. We also collected the dates and numbers for tests administered from the MHA dashboard. It should be stated that the dates collected from positive cases and tests administered do align. Slide. Using this collected data, the skills for coding were then learned and applied to calculate the positivity rate. Slide. The positive rate on the MHA Nation is reflected from March until August. The absent dates that absent data that you're looking at reflect that there were no positive rates recorded for those days. Slide. We then compared the daily positive rates in blue to an overall cumulative positive cases. Again, dates are the same from March until August. Slide. There were some issues with the data. Around June, tests were beginning to be rounded up, so we didn't get exact numbers. Tests were also not reported consecutively or consistently. On the positive note, the MHA Nation has begun to grant me access to the raw data in the hopes of improving data distribution to enrolled members on the Fort Berthold Indian Reservation. Slide.
So our next step is to create a visual how diseases can affect Native Americans in the United States. Thank you.
Slide.